Children aged 5 to 11 can now receive the Pfizer vaccine to protect them from COVID-19. Vaccination is the best protection children can have against COVID-19. Children aged 5 to 11 will receive a smaller dose of Pfizer vaccine created specifically for their age group. The dose for children aged 5 to 11 is 1/3 of the dose used in people aged 12 years and over. The vaccine is safe, with around 8 million doses of the Pfizer COVID-19 vaccine for young children delivered successfully across the world. The vaccine has also been provisionally approved by the Therapeutic Goods Administration and recommended by the Australian Technical Advisory Group on Immunisation. The recommended schedule for vaccination in this age group is 2 doses, 8 weeks apart. The interval can be shortened to a minimum of 3 weeks in special circumstances, including for those living with significant disability requiring frequent assistance with activities of daily living, before the start of significant immunosuppression, or before international travel. Children who are vaccinated will receive direct protection against COVID-19. By vaccinating your children, you can protect them from getting sick from COVID-19, protect other vulnerable family members from getting COVID-19, reduce the spread of COVID-19, keep schools open so children can have more face-to-face learning and playtime with their friends. While children and young people are less likely than adults to get severe symptoms if they contract COVID-19, some can still get very sick. This includes children with immunosuppression and chronic diseases affecting the heart, lungs, and nervous system. Children can transmit COVID-19, but vaccination will help decrease this transmission to other children and older age groups, including family members who may be at higher risk, such as grandparents. The paediatric Pfizer COVID-19 vaccine has been demonstrated to reduce COVID-19 in children 5 to 11 years of age. A clinical trial with 2,186 participants found 2 paediatric Pfizer doses was 90.7% effective at preventing symptomatic infection from COVID-19 in children aged 5 to 11 years. Can a child aged 5 to 11 who has had COVID-19 get vaccinated? Yes, they are still able and encouraged to get a COVID-19 vaccination if eligible. A COVID-19 infection will provide some natural immunity. However, it will decrease over time. Is the vaccine dose for children aged 5 to 11 the same as for people aged 12 and over? No, the dose of the Pfizer vaccine given to children aged 5 to 11 will be 1/3 of the dose given to those aged 12 and over. My child will be turning 12 soon. Should I wait for them to turn 12 and then have them get the dose for people 12 years and older? Your child is best to get their first vaccine as soon as they are eligible, which is now. If they turn 12 years of age after receiving their first dose as part of the 5 to 11 schedule, their second dose will be the higher dose for people aged 12 years and older. Does the vaccine have side effects? Like any other medicine, all vaccines can have side effects. Children can experience common and expected side effects after the Pfizer vaccine, such as a sore arm, headache, and fatigue. These symptoms can last 1 to 2 days and only need treatment with paracetamol. More serious side effects are very rare. There are no concerns about long-term safety of the mRNA vaccines in children. My child is afraid of needles. What supports are available to assist? Some children might be anxious about getting their COVID-19 vaccine or being in a new environment. This is normal. An experienced immuniser trained to work with children of all ages, abilities and backgrounds will be on hand to give your child their vaccine. If your child is overly nervous, immunisers might use visual distractions or vaccination aids, such as virtual reality headsets or Buzzy Bee ice packs, to help calm your child. Low sensory spaces are also available at some vaccination centres to support children with a disability or special requirements. To make vaccination a positive and fun experience for children and their families, our vaccination centres will also offer games, colouring books and other fun toys. You can book vaccination appointments for children now at state vaccination centres, GPs and pharmacies. To book at a vaccination centre, please visit www.coronavirus.vic.gov.au or call 1800 675 398. To book at a nearby GP or pharmacy, please visit the Vaccine Clinic Finder website. Monash Health's South East Public Health Unit also hosts pop-up vaccination clinics at local landmarks. You can view these and more vaccine information at www.cefu.org.